Hello, my name is Jessica, and I'm a senior here at SUNY Oswego, majoring in health and wellness promotion, as well as minoring in business administration. The disease that I'm choosing to talk about today is diabetes for the African American population. The rate of diabetes has tripled for African Americans in the United States. African Americans are actually 1.7 times more likely to have diabetes than whites. They also genetically are at a higher risk for developing diabetes. Automatically being at a higher risk for diabetes shows that doctors need to have a greater care for these patients. In the book Health Disparities in the United States, Barr quotes, "A physician must know the patient's ethnicity before being able to accurately predict and treat the risk of disease." This I find to be ultimately true. My concern is that for many reasons, African Americans have less access to needed medical care than whites and Asians. Knowingly that whites and Asians generate a higher household income, this is direct correlation to socioeconomic status and health. We need to stop doctors from judging a book as it walks into the office by its cover. A doctor should treat all of its patients equally, regardless of their ability to pay, their ethnicity, their race, anything. Doctors are there to help people, and it's time to care for others regardless of their ability to pay. If you're going to become a doctor or are already a doctor, your main reason for having this profession should be to help others, care for others, and help others go from a bad time to a better time. When a doctor has a patient, they should automatically think about how they can help them, not if that patient can pay, not if they have enough money, not if they were doing something awful to their bodies knowingly of a situation. It's important for doctors to realize these things and not judge these books by their cover. I believe that a successful intervention program is needed. A good one would be to approach different healthcare physicians and healthcare professionals and actually educate them on the genetic differences between races and ethnicities. If we're able to know these differences, having a patient, as a doctor, having a patient walk into your office and they're African American, you're able to think about all of the things genetically that are more likely to occur in their bodies. For one, diabetes is more likely to occur in African Americans, and that's based off of genetic information. If doctors study these differences between different ethnicities and races, they'll be able to better diagnose people and better treat people for what is going on. Not only will they be able to treat, but there will be more prevention because they'll know just off of a person's ethnicity what could possibly develop later on in their life. Judging a book by its cover needs to be eliminated. Not doctors who become educated about differences in different races and ethnicities relating to health will be able to eliminate this and not only better the health of African Americans, but better the health of all different ethnicities here in America. Another issue is that access to healthcare isn't as easy for African Americans as other races and ethnicities. For one, when having diabetes, you need to have constant care. If you have diabetes where you require insulin, you need to have refills on your insulin. You need to track your blood sugar. You need to make sure that it's not too high when you wake up. It's not too high when you go to bed. You need to make sure it's not too low when you go to bed so you don't wake up in the middle of the night. There's a lot of different procedures that go into this. And knowing that African Americans do have a lower income than other races here in America, it shows that they need healthcare that can afford all of these things for them. Not only that, but they also need to know how to feed themselves properly and healthily, especially with diabetes. Diabetics need to eat sort of very low sugar, low carb, and almost they need to generate the same type of foods each day to make sure that their blood sugar stays stable. If you're uneducated about these things, especially nutrition, you might not be able to properly treat and balance your diabetes. And this is a main issue that doctors need to talk about to their patients with pre-diabetes or even already have diabetes. This would be a big step in prevention and will also eliminate that once a patient goes home, they won't worsen, they'll actually get better. This is a step towards prevention, and this is just something that needs to be implemented and educated to doctors, physicians, and all healthcare professionals in order to better the overall health of all ethnicities in America and especially treat diabetes better for African Americans. Thank you.